We're going to talk about how to create a theory of change. So let me move on quickly to the next slide. So what we're going to do is talk about how you can approach writing this theory of change section when you write your grant proposal. So first of all, we're going to cover what is it. It's also called a pathway to impact. So don't get confused between the two, they're the same thing. We're going to talk about why it's useful, when and how to design the theory of change, and then how to make sure that the theory of change and the proposal text are all aligned. So the way that we're going to run this session is very similar to the previous one in this series, which Justin did a couple of weeks ago. So we're going to just talk around some of the practicalities and theories around how you do a theory of change. And then we're going to have questions and answers in a sort of clinic format. And thank you very much to those of you that have already sent questions in. So that means that if people don't want to stay for the questions and answers, they can just, won't be upset at all if you want to leave after the main session. And then at the end, there's a list of useful resources, not as extensive as the one that Justin gave everyone last time. So these are the questions that we've had so far, which I have tried to incorporate in the presentation, but obviously others may crop up. I can't see the questions as I'm doing the presentation, which is another reason for pulling them all together at the end. So just put them in the chat box and then I'll try and answer them together at the end. So first of all, the question we had was around how to develop a theory of change for a project, how junior researchers can create a pathway to impact. I'm not sure, that it's any different, which sort of whatever level you are, how to actually use it in practice. And then this last one is around the sort of requirements of proposals. The section on the theory of change says things like, how does a theory of change help you to be confident that your project activities are going to bring about the changes you intend to facilitate? And the text under there is the sort of text that comes directly from a proposal, just to give you an idea of the section in the proposals that we're going to refer to. Although theory of change covers virtually everything that you have to write in a proposal, which is why it is quite useful. So I know that some of you have got lots of experience of theory of change and some of you may not have a lot. So I'm going to go back to basics just to start off with. So what is it? So it's a method that was developed for programme planning and also to help evaluation, mostly used by funders and governments in development. So it's not just for health, you can apply it to any topic. It provides a comprehensive description and illustration of how and why a change is expected to happen in a particular context. And it really does help with planning, in that all of your activities are linked to how change actually happens through a pathway where you have to document all the steps on that pathway. And it also helps with the evaluation because it's possible to measure the progress towards achieving long-term goals that may well be beyond the project timescale, so that people can see what your longer term impact is, or what you hope it's going to be. And the other thing about theories of change are that you can't use anyone else's. You can use the framework and the same sort of approach, which I'll talk through, but you can't take someone else's theory of change and apply it to your project. They're absolutely individualised, bespoke for your programme or your scheme or your project. And they're very flexible and they're different from scientific theory. Sorry, my computer's completely up. Okay. So why is the theory of change useful? So these are the things that actually, for me, these are the main reasons why I find it really helpful. So this is a very personal list about why I find it useful. So first of all, I'm quite a visual person. So I need to see a diagram of the whole project in one place. And this theory of change helps to provide a visual snapshot of how the activities will eventually lead through outputs to the outcomes and impact. And in fact, if I'm reviewing a proposal and there's a theory of change in it, I might well go to that first, so that it gives me an overall view of the whole project before I actually start reading the details. It really helps with project planning. So it helps to get everyone on board. So if you've got multiple partners in multiple places, lots of different disciplines all coming together, it's really important that everybody gets their head around the project and they're all aligned, they've got the same vision. So you try and bring them all together. You can sort out their expectations, you can understand their context so that they can input to the whole project design. Ideally, to do that face-to-face is much better, but it's a really good tool for getting people on board. And just as an example, one of the jobs that we had to do regarding theory of change was to work with WHO, with TDR, the Tropical Diseases Research Team at WHO, and they're trying to get together with other groupings under WHO that are also doing similar activities around capacity strengthening for research. And so what we did was develop theory of change for TDR, and then also bring on board the other groupings and then expand the theory of change to include all their activities. And because they were all doing some research capacity strengthening activity, but they weren't joined up, this was a really good way to get everybody on the same page. So we just had the theory of change on the board and people would discuss and argue and change and put their activities and their goals in there, and eventually we harmonise it to be one overarching sort of programme plan really for all of the three groupings together, which was actually really complicated, and without a theory of change I don't know really how they'd have been able to do it. So third bullet point, the theory of change makes you really think about the links between what you're putting in, so all the activities that you're doing, what those activities are going to lead to in terms of concrete outputs that you can show the funders you've done over the project time. And then beyond that, things that you hope are going to happen as a result. And finally, the larger impact that you're going to contribute to. And it also helps you think about each of those stages and how you might move between one and the other. So what are the barriers? What are the things that are stopping you moving between each of those different stages along the pathway? And that helps you, really helps you write your risk and assumptions section. So if you've been asked to write a draft risk register for your project proposal, this is where you get your information from, by looking at the barriers or problems that might arise between each of these different stages. So the other thing that a theory of change is really useful for is thinking about who needs to be involved at each stage, and it may be different people. So when you have to write your section that talks about, usually there are several sections, there might be one about defining who all your stakeholders are. How are you going to engage with them? Who is your audience for dissemination? Who are your research users? All those sorts of sections you can write if you think about each of these different stages along your theory of change. So the other thing about a theory of change is that it helps get everybody's expectations aligned. So it shows you what is and is not within the control of the project. So some things are outside the control of the project, but you need to mitigate them and think about them. Some things are going to happen long term, but some things you are absolutely directly responsible for in your project, and the funders will expect you to report on them and deliver outputs against them. And so you can differentiate between all those different things on the theory of change. And then increasingly now, some of the funders are actually developing a theory of change for their overall scheme. So, for example, we've been involved with NIHR, helping them develop a theory of change and how to use it for their global health programs. So what the funders then say in their proposal guidelines is that you need to align your theory of change with their overall scheme level theory of change. So we're going to touch on that a little bit as we go through the rest of the session. So first of all, when do you do it? When do you design a theory of change? So ideally, if we're doing this in practice, the time really to do it is once you've got a few ideas about what you want to put in your proposal, you've bashed them around with some partners by phone or Zoom or whatever, and then ideally a face-to-face meeting. So a 2-day workshop, proposal development workshop, where you start to develop your theory of change. So you do it very early on. It then means that everybody's on the same page, and then you review it again before you finally submit it. So if everyone has had these discussions, all your partners have been there, they've all said, we can't do that activity, it takes too much time, or that's not a priority, or if we do it like this, the ministry won't be happy. All those sorts of inputs can be put onto a theory of change so that eventually it's the best it can be with everybody's inputs by the time it actually goes in as a proposal submission. It also means that if everybody is understanding the big picture, it's much easier to ask different partners and different people to write different sections, because you know that they've got the understanding of the big picture, and so you don't have to do so much work trying to harmonise everybody's different inputs when it comes to actually sending your proposal in. So if it is possible to do it face-to-face early on, that's the ideal time. If it's not possible, then you can do it by email or by, you know, having a Zoom meeting, but it's not as easy. So how do you design a theory of change? We're going to go through step by step in a second, but you need to start with some sort of framework, some sort of diagram. If the funders have one for the scheme for which you are applying, it's a good idea to use that one, because they will be familiar with that. You'll make sure you've got the right sort of terminology in yours if you pick some of their keywords, and if you look at their goal and make sure yours is aligned with theirs. So if there's a funders one, then obviously you need to bear that in mind and use it if possible. The idea is to use their framework, not all their words, not all the things they put in the boxes, but the way they've laid it out. If it works for you, you can make your own completely from scratch, and I'll give you a sort of template or an idea of the sort of things that you could put in it. Or you can take someone else's, and we have a few stock ones that we've used, that we've developed for various different people or for our own use. So we've got a sort of pile of theories of change that we can pick on depending what the proposal requires. Do be careful, because some of these theories of change are confidential. So for example, the one I mentioned about WHO TDR, that's confidential, so I can't show it to you as an example. They also had an internal one which was very detailed, and an external one that they used just for internal WHO communications. So don't just plagiarise someone else's theory of change. It does, as I said, they're unique for your project, so they will be your own special one, but the way it's laid out, you can look around at different other ones and see which one suits your purpose best. So let's just go through a few examples of theory of change so that you can see just what they look like. So this is an old one of ours from Centre for Capacity Research, which looking at it again, we need to do quite a lot of work on this. I think it's time we revamped it. But there are some key elements that generally occur in theories of change. So if you look down the left-hand side, you've got impact. So the green left-hand box, impact, So all those green bars describe various stages. So the top one is the very high level impact that we want to achieve. So health, well-being, economic development in LMICs. But obviously we're not going to achieve that in a project, but hopefully that is something we're contributing to. I'm not going to go through all these boxes, but if you look down the left again, the next one is outcomes. So outcomes are things that are sort of near term after the end of your project. And they're the ones that lead on to the impact. Below that, you normally have outputs, but we didn't use it for here because we have a separate plan for our outputs. And then you have the activities. And just in our case, our activities are listed around 3 pillars. So one is about research capacity strengthening, so increasing research demand for evidence. Pillar B is around developing a research community, doing research on research systems, and Pillar C is around research supply. So, but you know, your project will have your own activities list here, and they may not be called pillars, they might be called work streams or themes or work packages, or however you're dividing your project up. On the bottom here, we've put a problem that quite often theory of change doesn't have a problem statement on the bottom. Depends a bit on how much room you've got, how packed you want this to look. Then on the side, on the right-hand side in the grey box, we've put here some of the potential risks and assumptions. So that's just one example. This is an example off the internet. This is an example from Comic Relief. It's about their big malaria programme. But again, you can see they haven't got things labelled, activities, outputs, outcomes, impact, but you can see that's how it's laid out. So if we start at the bottom, again, they've called their activities pillars. They've colour-coded them, which often does help follow this, help the reader to follow this through. So at the bottom, they've got a bit of a problem statement under those pillars. Then they, as you move up, they've got very broad ideas about outcomes, and then right at the top, green is impact. So again, you can see the sort of structure. And this is obviously very truncated idea of what might be in a much bigger project document or scheme document for the funders. This is one which is causing me a lot of pain. It's one for a proposal that's actually going in today. So just to talk you through this one, again, on the bottom, we've put principles. So for this particular project, it's very patient-centred. It's evidence-based. We've got sustainability as quite a big component. So I've put principles across the bottom, but you don't have to have that. The activities, we've got these divided into 3 different sections. So we've got what you might have in many projects, a sort of baseline study, which is the bottom yellow left-hand box by activities. Then the baseline study is leading into implementation. I'd be grateful if people could mute their microphones if they're not muted already. Thank you. So the middle box along the bottom is about the actual main research activities that we're doing. And then on the right-hand box, because capacity strengthening for this particular call is a very big component, we've got an extra box here dealing with capacity strengthening activities. I also did toss up about whether we should have another box here around dissemination, engagement, communication, because for this particular call, that is also a big component. So the way that you lay this theory of change out depends a bit on what the emphasis is within the call. So if capacity strengthening or public engagement are big components of the call, then you might want to represent them on the theory of change. If they're not, then you might just want to have your major research activities divided up into work streams. So it's up to you really how you lay this out. So the next level is the outputs level, and essentially those outputs are taken directly from the proposal, but they're just truncated to fit them into the box. So this is the way that you can align everything with your proposal. You can go backwards and forwards between your narrative in your proposal and the theory of change diagram and make sure that they all say the same thing. And you will need to go backwards and forwards and tweak everything all the way through as you go along. So then at the top, we've got outcomes. These are things that we are fairly certain that our project will achieve, but they're not deliverables for the project. They occur after the end of the project. And then at the top, we've got the things that we're really contributing to, but we can't attribute those things to us. Those are longer term things that we hope we will impact on. And if you look down the right hand side, there are two boxes. So this is really important to think about. So the things that are under your actual control within the project, so things you're given money for and things you have to do and show you've done, stop at the top of those green boxes, which is the outputs. After that, there are things which are mostly out of your control. And so those are things that you contribute to, but you're not directly responsible for. And this is why it's a pathway to impact. So you start with your activities at the bottom and your outputs, which you are going to produce from your project. And then you have outcomes and impact, which are things that you hope you're going to achieve or make a major contribution to in terms of outcomes, particularly, but you're not responsible for actually making them happen within the project. And so that's how the funders can see how your activities right at the bottom are going to eventually have some sort of impact on your big goal and vision. So this is another theory of change. This is the Newton Fund theory of change available on their website. And at first it looks really daunting, but actually if you look again, the structure is very similar to the previous ones. So if you look on the left, you've got activities, outputs, outcomes, and then you've got impacts. And this is for their whole Newton Fund scheme. So within this, they have to represent all the different types of calls and activities that they've got going on. And again, you can see they've got pillars at the bottom and they've divided them into people, research and translational pillars, each leading upwards into various outcomes. So again, although it looks daunting, the structure is similar to the previous ones. So how do you actually do this step by step? So you need to start off with some sort of framework, and these are the sorts of things you might want to consider putting in a framework. You don't have to have them all in. So at the bottom, you might have your problem statement, as you saw some of the others have. You might put the name of your pillar. You might put the principles right along the bottom that your project is going to adhere to. And then you've got activities, outputs. There's that turquoise line is assumptions, and we'll talk about that in a second in a bit more detail. But if you've got space, it is a good idea to put assumptions in your theory of change. And then you've got outcomes and impact with a goal or a vision, or you could combine the goal and vision. Quite often it's good to align those very closely to the funder's scheme goal. So you might want to pick some words from their goal that you can also put into your theory of change. And then on the right hand side, just to remind everyone, things which are under your control are outputs and below, and things that you are out with your control are outcomes and above. And you need to work backwards and forwards, up and down between the goal and the input. So if you're running a workshop, if we're running a theory of change workshop, we start, often we start with the activities that people have got going on already, or the activities that they want to do. And then we look at the goal, and then we try and fill in the boxes of outputs and outcomes in between, and look at all the components that you're needed that are needed in each of the preceding stages. So again, inputs, activities, output, outcomes, and impacts. So we tend to often start with the activities because we have an idea of what we want to do, and the impact is dictated a bit by the scheme you're applying for. What does the funder want to achieve from that scheme? What's the major output from it? So for example, a lot of the NIHR or the Overseas Development Assistance grants want things around inclusion, reducing marginalisation, LMIC-led, sustainability. Those are the sorts of words they use in their proposal guidance. So you might want to reflect some of those in your goals and impact. So if you're thinking in detail about how to do it, I just created this very brief short example. So suppose that we want to set up a COVID vaccination centre and just start giving the first few vaccines. We've got 2 months to do this, and we want to make a theory of change. In practice, we wouldn't make a theory of change for something short and sharp like this, probably, but just to give you an idea of the sorts of thinking that goes behind actually constructing a theory of change. So if we think about the inputs, these are the resources that are going to be used, and it does help to think about, you know, how much money have you got, how many people, what's the geographical area that we might want to cover. Those are the sorts of things that are going to dictate with your inputs. Then the activities, that exactly what are you going to do with the resources that you've got available. The outputs are going to be what are the products from all these activities that you're going to do to set up this COVID vaccination centre. And then the outcomes are beyond your control. These are things that you're not going to achieve in the project, but they're benefits that you are going to have a substantial contribution towards. And then the impact is about the longer term consequences. So let's look how this plays out. So the inputs, the sort of things that if you want to set up this centre, you're going to need staff and vaccines and consumables, and you're going to need a place to do it and some publicity to get people to come for the vaccination. So those are the sorts of things you know you're going to need in the back of your mind. The sorts of activities that you're going to do are going to be around recruiting staff. You need to advertise. You need to physically set up some centres. You need to have some sort of documentation, and you need to have some sort of client follow-up. Those, I mean, this is not comprehensive. This is just to give you an idea of the sorts of things you might want to think about and put under an activities section in a theory of change. Then if we think about the outputs from this particular project, so for the question marks, you need to be very sure at each of those question marks that one leads to the other, leads to the other. So if we have outputs from this particular project, some of the things we might want to measure. So this is where it helps with evaluation. So if the people giving you money to do this want you to show them what you've done with the money, the sorts of things you might want to show is the number of vaccines given. You might actually want to have a record of side effects, for example, or the number of staff trained might be an important thing to have. Don't forget, some of these outputs might be qualitative rather than quantitative. So don't just think about numbers. So for example, you want to show you've set up a quality service, you might want to do some sort of interviews or focus groups to find out if this is a patient-friendly service, if people find it accessible, if the staff are friendly, you know, if this is a good quality service. That showing it's a good quality service is another evaluatable output. So after you've done your setup and you've given the first few vaccines, you've achieved what you said you were going to do. So the next bit, which is about outcomes, is not under your control, but you probably have quite a big impact on this. So because of what you've done, you might reduce healthcare visits, you might reduce long-term COVID complications. And if you look finally at the green box, the longer term impact, which you definitely can only make a tiny dent in, is things like reduced deaths and hospitalisations. So the work you're actually going to do is around the activities, and the outputs, outcomes and impact are the results that you're going to achieve. However, the first three are what you are responsible for. So when you're asked for example, the proposal we're just putting in has asked for deliverables and milestones. So those should only cover things up to the yellow boxes. So don't promise to deliver or count as a milestone something that occurs as an outcome. So, reduced healthcare visits is not something within your project. So don't put it in as a deliverable or something that the funders can measure, or that you can demonstrate to the funders that they should measure, because it wasn't part of your remit. And then you're contributing to the outcomes and impact. So there are some assumptions, and I mentioned this earlier. So let's talk a little bit about assumptions. So it's really important to think about assumptions, because nobody's project goes right. A lot of things are out of your control, particularly if it's a big project over 4 or 5 years with many partners in different sites. It's almost inevitable that there are things that you can't control and things are going to go wrong. But what the funders want to know is that you've really thought about this. You've thought about what could go wrong, and you've really tried to put in mitigating activities to try and reduce as much risk as you can. So there's often quite a big section about that on your proposal, and the theory of change will help you try and think about that in a very systematic way. So the main area to look for writing the assumptions and where they occur is between the outputs and outcomes. So the funders want to know that you are really on a pathway to achieving your big impact, even though that's beyond the end of the programme. So if you look at your outputs and your outcomes, that's the place where you really want to focus your efforts to try and think about what are the assumptions, what are the risks, and what can we do to stop them. There are also some assumptions between the outcomes and the goal, but because the goal is so high level, for example, increasing well-being in LMICs, it's actually really difficult to be specific. So it's probably better to focus most of your efforts between outcomes and outcomes, that link, that stage. So this is another thing that's really useful, to have all your partners in a room discussing this together, because they know what a lot of the risks are in their context and you don't. So it's really important to get, if you've only got limited time or you have to do this on a Zoom call, discussing the assumptions very specifically between the outputs and the outcomes is a really important thing to do. So you need to ask them, what are the things that could jeopardise moving between outputs and outcomes? So if I just go back to this one, if you look at the outputs, so the outputs for this COVID vaccination centre are the number of vaccines given, maybe side effects of the vaccines documented, staff trained, providing a quality service. And then your outcomes, which are not in your control, are reducing the number of healthcare visits, reducing chronic COVID complications. So if you want to think about the assumptions between those two, you're making an assumption that if you give vaccines, you're going to have reduced healthcare visits. So what are the things that are in that gap. How will you get reduced healthcare visits just by giving vaccines? And you need to think about all the things in there that might affect your outcome. So it might be things like, you know, access to healthcare centres is available, or people trust the healthcare system. You know, you can think of any number of reasons why your outputs might not directly actually lead to your outcomes, or what might stop them. So within the proposal text, because you won't have a lot of space in the actual theory of change, you can write in detail what are all those assumptions, what are the risks, what's their effect, and what's the likelihood of them happening. So some funders even want you to score these risks. So you need to think about what are the priority areas, what are the things that are most likely to occur or which are going to be most damaging if they actually happen. And then for each of the assumptions that you've made or the risks you've identified, you need to describe what you're going to put in place to try and mitigate that. And if it requires budget, you need to include budget for that and explain why, justify why you're including budget for that. You can put boxes about assumptions in the theory of change if you can fit them in and you want to. It's sometimes quite helpful to do that. Sometimes they just don't fit. So I'm just going to, in the last couple of minutes, touch very briefly on a couple of other areas that often come up in proposal guidelines that you have to complete and which are implicit in the theory of change. So sustainability of anything that you've introduced is often a big issue that you have to describe. And although I can't give you details about sustainability because it will vary very much for each of your projects, there are some things that you generally might want to think about including if you have to talk about sustainability. So in the early stages of a project, so things like engaging stakeholders in whatever you're doing, talking about how you exactly will plan for scale up, how you might influence policy if that is a relevant thing for you, and also including what I've called quality assessments, but this means providing really high quality evidence. So put in things that make your evidence very strong so that it can be disseminated, it can be used, it can be trusted. So these are very generic ideas. You'll have to adapt them for your own particular projects. So in the mid-project, the sort of things that funders might want to see to show that you're on a pathway to sustainability are things like having improved resources in your LMIC partner countries. For example, you know, you might have stronger research management systems, or you might have trained a finance officer, or you might have, you know, helped develop some seminar series. Also think about how you might institutionalize your activities. So, for example, if you're setting up training courses in the early stage of your project, how might those training courses be taken over by the local institutions so that they can run them in the long term? What are the sort of activities you might want to include to make sure that that happens? And they might be different from your main research project, but they will help sustainability. So, you know, you might want to train some vector biologists, and you start off by going in yourself to train them, and then you train trainers. So the mid-stage indicator of sustainability might be that you're beginning to train some local trainers to take this over in the long term. And then towards the late stage, the sort of things you might want to include about sustainability towards the end of your project is that when you leave your project, you've got some additional funding for core activities. So one of your activities in your project might be to support some proposal writing workshops, for example, that are, and potentially, you know, these things might be led from your partner countries, whereas in the beginning they weren't. So these, if you have to put in something about sustainability, these are the sorts of things you might want to think about, but you're going to have to adapt them very much for your own particular projects. And then some of the things that we know are difficult. So these are sort of assumptions or risks to trying to achieve sustainability. So high turnover of staff. So a lot of staff leave within your 4-year project, so you have to retrain. The other important thing is that Ministry of Health people often turn over very quickly as well. So you might have got very good engagement with your ministry stakeholders in year 1, and by year 4, it's a completely different group of people in the ministry. So in your proposal, you need to think about how are you going to deal with that? What activities will you put in place? So you might have, you know, 6 monthly meetings with stakeholders. And the justification for that is that, you know, turnover is high and you need to keep them engaged. And therefore you need to budget for those workshops or those meetings. Trying to embed changes into existing systems is very difficult. So again, you need to think about how you're going to do that. How will you mitigate not doing that? And securing funding, influencing policy. These are all some of the most difficult things to achieving sustainability. So they're the sort of things you could put into your risk section or your achieving sustainability section for the proposal. So finally, as I mentioned, some of the funders are now beginning to develop their own scheme level theory of change. And you saw that one for Newton, NIHR have one, the African Academy of Science have one for their Deltas consortia, and you may well see others. And the funders are asking people writing proposals to make sure that their project theory of change aligns with the funders one. So this is just an example of the very big picture if you look at it from the funders' perspective. So if you just look at the right-hand side, most of the funders that we work with who are working in development are looking towards something around the impacting on the sustainable development goals. So they'll have something around those in their big vision. And then in their scheme goal, they'll reflect those SDGs. So if those two oval sections are about the impact that the funders want to have on SDGs. And then below that, you've got the funders' programs, and they're trying to collect together all the information about the outcomes and impact from all their programs and fit them into their big theory of change. And then underneath that, you've got the projects and the consortia, and you've got the individuals, the institutions, and then what I've called societal, but that's things like research collaborations, research networks, dealing with national research systems and policymakers and stakeholders. So it's anything above the institution. So the funders have to think about all of those things when they're designing a scheme level theory of change. And so if we look at the left-hand circles, if you look at the bottom one, that's your project or your consortia, and you've got a plan and a theory of change, which is the orange triangle. And that might lead into the bigger program. So it will align with what the funders have written for their theory of change in the bigger program. And as you can see, you go up through the levels. So your theory of change reflects what the funders' theory of change also says. So pick up some of their words, maybe use the same structure for their theory as they've used for their theory of change. So I'm going to just stop there, but just to remind you, I think I've covered those questions that came up prior to the session.